3 best vitamins to lower blood pressure. Over 30% of the world's population has high blood pressure, which is regarded as the most modifiable risk factor for heart disease and premature death. Poor dietary habits are one of the primary causes of the disease, which accounts for approximately 13.6% of global mortality rates each year. What you eat plays an important role in managing hypertension and living a healthy life with the disease. Whether you've been diagnosed or are at risk of developing hypertension, it's critical to understand the complexity of the disease and how to self-manage it. Why blood pressure matters. According to the British Heart Foundation, more than a quarter of UK people have high blood pressure, and the condition is responsible for around half of all heart attacks and strokes. Furthermore, an estimated 5 million of us have undetected high blood pressure, hypertension, which typically presents with few, if any, symptoms. Getting your blood pressure under control is one of the most essential things you can do to minimize your risk of heart attack and stroke. Therefore, monitor it often. This can be done by your doctor, practice nurse, local pharmacist, or at home. Can supplements lower blood pressure? The short answer is yes. Some supplements have an antihypertensive impact, which means they can lower your blood pressure. But it is more complicated than that. Experts have discovered that a variety of supplements can reduce blood pressure, some more than others. Some lower systolic blood pressure, which is the amount of pressure that blood exerts on the artery walls while your heart beats. This is the first or highest number in a blood pressure reading. Others may drop the diastolic blood pressure, which is the second or lowest reading. It measures the amount of pressure your blood puts on your blood vessels when your heart is resting between beats, and some seem to benefit both. However, if your blood pressure is extremely high, you don't want to rely on a supplement only. It could take months before you see the results, which is much too long. What vitamins can help lower high blood pressure? While the body produces some vitamins, the majority of them are available in food, albeit in modest quantities. Different vitamins have various functions in the body, and some can help decrease blood pressure. This is critical for individuals suffering from hypertension. So here are best 3 vitamins to lower blood pressure. 1. Vitamin C. Anecdotal evidence suggests that long-term vitamin C supplementation, 500 milligrams per day, can lower blood pressure. While more research is needed to understand the physiological significance of vitamin C and its impact on blood pressure, experts have proposed explanations. The first explanation is that vitamin C, as an antioxidant, raises amounts of nitric oxide in the body, which is required for appropriate blood vessel function. Nitric oxide relaxes blood vessels and promotes normal blood flow. However, oxidative stress inhibits its production, leading to blood vessel degradation. The second explanation is that vitamin C acts as a diuretic, helping to remove fluid from the body and therefore lowering blood pressure. Hypertension causes an increase in blood volume due to elevated salt levels. Diuretic drugs remove excess sodium and bodily fluids through urine, reducing stress on artery walls. Natural sources of vitamin C. Vitamin C supplements have been shown to be useful in the treatment of hypertension and illness prevention, among other benefits. Although there is no significant difference between natural and synthetic sources, natural sources may contain additional nutrients, increasing their overall nutritional value. Natural sources of vitamin C include citrus fruits like oranges and lemons, strawberries, pineapples, green, leafy vegetables, potatoes, and tomatoes. 2. B vitamins, B9, B6, and B2. The B vitamins are a group of vitamins that perform various roles in cell activity and blood production. There are 8 B vitamins in all, however only 3 have any effect on hypertension, namely vitamin B9, vitamin B6, vitamin B2. Vitamin B9, commonly called folate, is necessary for blood production and cell growth. Folate supplements can help lower blood pressure by increasing blood flow and relaxing blood arteries. Folic acid is an antioxidant that helps minimize oxidative stress, which affects the action of nitric oxide and lowers blood pressure. After 6 weeks of folate supplementation, one study found that hypertension individuals' systolic BP decreased significantly. In contrast, there was little to no change in diastolic pressure. Animal studies have shown that vitamin B6 can lower blood pressure. However, no human research has been carried out to support this theory. Scientists believe that because low levels of vitamin B6 are common in hypertension individuals, getting enough of it can help prevent the condition from developing. Vitamin B2, often known as riboflavin, has been linked to reduced blood pressure in patients who have a methylnetrahydrofolate reductase (MTHFR) gene mutation. The MTHFR gene is important for folate production, which promotes regular blood flow and blood vessel health. Mutation of MTHFR interferes with folate synthesis, increasing the risk of hypertension and cardiovascular disease in affected adults. Therefore, riboflavin supplementation can reverse these effects. Natural sources of B vitamins. Different foods have different B vitamins. Natural sources of vitamin B9 can be found in whole grains, seafood, peanuts, green leafy vegetables, beans, sunflower seeds. Natural sources of vitamin B6 include white meat, pork, poultry, and some fish, oats, bananas, soybeans, wheat germ, peanuts. Vitamin B2 can be found naturally in yogurt, lean meat, salmon, chicken, spinach, almonds, dairy products, and eggs. 3. Vitamin D. According to studies, people with hypertension have lower vitamin D levels than those who are healthy. As a result, vitamin D supplementation could reduce the risk of hypertension by 30%, while also lowering blood pressure in those who have been diagnosed. However, other studies dispute the effects of vitamin D in decreasing blood pressure, thus further research is needed to back up the claim. Low temperatures, popularly known as winter hypertension, may elevate blood pressure, providing plausible evidence of the link between vitamin D and hypertension. Winter brings less sunlight, which can lead to vitamin D deficiency and hypertension, showing a relationship between the two. Natural sources of vitamin D. Vitamin D comes from sunlight or food sources such as egg yolk, red meat, liver, oily fish, examples, sardines, salmon, mackerels, herring. Well, there you have it, 3 best vitamins to lower blood pressure. While some supplements may lower blood pressure, it does not imply that every supplement is safe. It's critical to understand that many supplements can interact with popular medicines, including blood pressure medication. Before taking a new vitamin or supplement, consult with your healthcare provider to ensure that it is appropriate for you. Hope the video helped. Thanks for watching.